You say in America, our fear of socialized medicine has led to huge inefficiencies, you say, in terms of delivering healthcare, the scarcity in healthcare, high-cost healthcare. Totally agree. I cheered again. So why don't you make the case for socialized medicine then? Why do we not see any mention of Medicare for all in the book? That would be a way of dealing with scarcity. That would be a way of dealing with the huge inefficiencies in the US healthcare system.
I believe in a single-payer healthcare system. I think that'd be the best path forward. I also want to be politically realistic. I also want to be politically realistic, right? I mean, a good book has to be focused. A good book has to understand what is the core argument that it's trying to make. We can't make every single argument. We're not talking about every single thing that could possibly be good in any political future. We're trying to make a very clear argument that in many ways, the problems that Democrats face are the result of rules that they allow in the systems that they design, right? That is one very clear clear, narrow argument of the book. When it comes to socialized medicine, I think there are, of course, if you look at the case of Europe, arguments for having a single-payer system that is allowed to negotiate prices with the private sector to drive down prices, especially for the working and lower classes. There's a lot of good arguments for this. If you look at the politics of single-payer healthcare, it's incredibly fraught. And so rather than write a chapter about the fraught politics of introducing Medicare for all, right, which is a chapter of a different book that I could research and write and represent the arguments for, I think, very sincerely, I wanted to focus in my chapter on medical science, on the ways in which the value of healthcare is not just determined by the card that you own, it's determined by all the things that that card buys. So people like you, people like me, throughout the Democratic Party in the last few decades, we've been very focused on universalizing healthcare. And again, I think that's a mitzvah. I want universal healthcare. But sometimes in our emphasis on focusing on universal care, we think a little bit less on what that universal care actually buys. Yep. And I think it's really important to have an invention agenda in America that focuses on all the medical technologies and the science that allows that healthcare card to buy more drugs that extend people's lives.